the Minister for Health, and the action I seek is for the Minister to commit to match New South Wales' $75 million contribution to the health service to jointly fund improvements to the intensive care unit and surgery and any capital works identified by Albury Wodonga's Health Master Plan to be released later this year. Albury Wodonga Health was formed 11 years ago by the man who is now the Victorian Premier. And while Wodonga alone has grown by 20% in that time, the service has failed to receive its fair share of Victorian capital funding to keep pace. In stark contrast, in the past 3 years, the New South Wales Government has recognised the incredible demand on staff and facilities and committed $75 million into capital works at the health service, $45 million to improve the intensive care unit and create additional surgical theatres and beds, and $30 million to eliminate the dangers of an emergency department seeing 3 times the patients it should. Now, the Victorian Government was shamed a $6 million contribution to the emergency department, but only after the Victorian Government's own bureaucratic delays added that much to the cost of the project. At the time of that announcement, the then Health Minister, now you'll remember her, she was the one that was thrown under the bus by the Premier. Unfortunately, it wasn't at Albury Wodonga Health because the emergency department seriously is underfunded. But back to the question, Ms McCarkos at the time said the agreement between New South Wales and Victoria, which underpins the only cross-border health service in the nation, was close to being signed. It was already 2 years out of date then, and 12 months later, Deputy Speaker, it is still not signed. Last November, in a delayed state budget that borrowed billions of dollars, there was still not one additional cent for these vital projects from the Victorian Labor Government. This is a Victorian hospital looking after 250,000 people, more than half of them Victorians, some say up to 75%. Minister, why do you refuse to match the New South Wales capital funding, or is this part of your plan to withdraw from that agreement and make Wodonga Hospital an outpost of Wangaratta North East Health? I'll spell it out again, of Wangaratta's North East Health. The Bush Telegraph in the North East tells me there is a deal, now driven by North East Health, looking at a mega merger with Albury Wodonga Health and the Benalla Health Service. Now, I fear this feasibility study is more about gaining the IP to cut out Albury. It will be a retrograde step for the community and a health service that sees more patients than all but Geelong in regional Victoria. One that boasts a state-of-the-art cancer centre, among other unique specialist services, one that serves 2 large regional cities and it's all its satellite communities. In December, I asked the Health Minister for details around the Victorian Government's capital contribution to Albury Wodonga Health since 2015. But important, Minister, the people of the North East deserve to know, are you walking away from Albury Wodonga Health?
Member for Bass.